Hi, I'm from the UK and I'm a very patriotic Brit. There's a lot for the UK to be proud of, and above all, its proudest achievement is the institution of the NHS, the National Health Service. The NHS is the umbrella term for all publicly funded healthcare in the UK, allowing British citizens of all financial statuses to have access to healthcare. Brits take pride in the NHS. According to a 2018 survey, 53% believe it is what they are most proud of in Britain.
Something that we have grown up with all our lives.
It actually helped to save my life when I was a child.
We really depend upon it.
One of the greatest political achievements of the post-war era.
But the aforementioned number of 53% has fallen from 70% in 2010. So what happened? Well, a large part of it can be attributed to Brexit, the withdrawal of the UK from the EU.
Brexit has had a devastating effect on the NHS.
It really did impact on the service.
Many public figures supporting the cause believed that internalised resources would benefit the UK's economy, cutting costs of providing for other nations and letting the flow of money in the UK surge the economy itself. In 2016, 51.3% of the citizens voted to secede from the Union. And here's how it affected the NHS. A 2019 study from the University of Sheffield found that the immigrant-heavy workforce of the service would be depleted by Brexit.
Waiting times have increased and the standard of care, unfortunately, has declined.
It does take that bit longer.
Limiting access to vaccines, equipment and medicines. According to The Guardian, a number of EU nurses registering for the NHS fell 96% from July 2016 to April 2017.
Doctors, nurses and everything, they had to leave.
The delay in the formal exit of the EU caused pharmaceuticals to work with the civil service to conserve medical supplies in case of a worst-case scenario exit. A promise from former Prime Minister Boris Johnson that the NHS would receive £350 million a week post-Brexit was not fulfilled. The institution took a major hit after this move, and good times are not on the horizon.
And then, of course, we had COVID.
1 year later, the COVID-19 pandemic hit the world. The national GDP fell almost 20%, the most of all G7 countries, putting a strain on the healthcare itself through a lack of tax pounds.
For a knee operation, you could be waiting 2 years.
The NHS struggled for funding and staffing, even at its most desperate times.
I think the frontline workers that were let down politically, lacking the resources that they needed.
There were half the nurses staffed in the pandemic than there were in 2015. The increase in funding has not nearly combated the needs of such money. A combination of Brexit, underfunding and COVID have systematically run down the NHS. And despite in a time of the most public support the NHS has ever gotten, the layers behind their funding tells a different story. As for the future, though the situation has not been as bad as 2020, we have still not fully recovered. And the NHS crisis still continues to this day.
So it's definitely going better.
I think it's going to be incredibly hard for the NHS to recover. Maybe it just has to look a little bit different going forward.
The UK can only hope their most proud achievement can recover to full form again.